As 2026 gets closer, people already on Medicare and those preparing to sign up are about to face some uncomfortable truths. Medicare is an essential program, but it still leaves out big pieces of healthcare that almost everyone needs at some point. We're talking about vision, dental, and hearing, along with a couple of other gaps that often catch people off guard. And the price tag for these uncovered services. It can add up to thousands of dollars every single year. For anyone living on a fixed retirement income, these out-of-pocket expenses can mean the difference between feeling financially secure and struggling with stress. That's why in today's video, I'm breaking down the 5 biggest things Medicare will still not cover in 2026, so you know exactly what to expect and how to plan ahead. Stick around until the end, because I'll also walk you through a few important 2026 updates, things like prescription drug costs, vaccines, and insulin that could actually save you money. Number 1. Vision care. Let's start with your eyes. Original Medicare doesn't cover routine eye exams, eyeglasses, or contact lenses, the only exception. If you've had cataract surgery, you're entitled to 1 pair of glasses or contacts afterward. That means if you just want a yearly vision checkup or need a new prescription, Medicare won't step in to help, and those bills add up fast. A basic exam can cost between $100 and $250, and a decent pair of prescription glasses can easily run a few $100s more. Contacts, expect another $200 to $300 a year, sometimes even more depending on your needs. Some Medicare Advantage plans throw in a vision benefit, but usually it's limited, maybe a partial exam or a small allowance for eyewear, capped around $150 to $200. That's rarely enough to cover the real cost, especially if you need progressive lenses or specialty frames. And here's the bottom line. In 2026, nothing changes. Original Medicare still won't pay for routine vision care. The only exams it does cover are medically necessary ones, like screenings for glaucoma or diabetic retinopathy. If vision care matters to you, your options are to shop for a Medicare Advantage plan that includes vision benefits or buy a separate vision insurance policy. Number 2. Hearing aids. Now let's talk about hearing. Original Medicare doesn't pay for hearing aids or the exams required to fit them. The only coverage you lines get is for diagnostic tests if your doctor orders them to look into a hearing or balance problem. Beyond that, the costs are all yours, and this gap is one of the priciest. Quality hearing aids often range from $2,000 to $6,000 per pair. Most people need 2, and since devices typically need replacing every 5 to 7 years, you could be looking at thousands of dollars out of pocket again and again. Yes, there's been progress since 2022 with over-the-counter hearing aids, which are available at pharmacies and big box stores for as little as $800 to $1,000 per pair. That's cheaper, but still not pocket change. And importantly, Medicare won't cover OTC hearing aids either. Some Medicare Advantage plans include hearing benefits, but they vary widely. Some give a few $100 toward the cost, while others just provide discounts if you use specific providers. So, make sure you read the fine print before assuming you're covered. Number 3. Dental care. Next up, your teeth. Original Medicare does not cover routine dental services. That means no cleanings, no fillings, no extractions, no dentures, no implants, and no root canals. The only time Medicare will step in is if the dental work is tied to another covered medical procedure, for example, dental clearance before an organ transplant, an exam before heart valve surgery, or oral surgery linked to certain cancers. These situations are rare, though CMS has expanded them slightly in recent years. For most people, everyday dental care is completely out of pocket, and it's not cheap. A simple cleaning can cost $100 to $200. A single filling might run $150 or more, and if you need an implant, that can set you back $3,000 to $5,000 per tooth. Number 4. Long-term custodial care. This is the most serious gap and the one that surprises people the most. Medicare does not cover long-term custodial care. That means if you need help with daily activities like bathing, dressing, or eating, or if you move into a nursing home or assisted living for non-medical reasons, Medicare won't pay a dime. What it does cover is short-term skilled nursing for a hospital stay, but even that has strict limits. You must have been hospitalized for at least 3 days, and then Medicare covers the first 20 days in full. From days 21 through 100, you'll owe a daily co-insurance. After day 100, you're on the hook for everything, and those costs are staggering. A private nursing home room averages around $100,000 per year. Assisted living typically costs $50,000 or more annually. For anyone who needs care for multiple years, savings can vanish quickly. The only safety net is Medicaid, but you must meet strict income and asset limits to qualify. Another option is long-term care insurance or hybrid life insurance policies with long-term care riders, but those are most affordable if purchased earlier in life. Number 5. Annual physicals. Finally, let's clear up a common misunderstanding. Annual physicals. Medicare does not cover a traditional head-to-toe physical exam with routine lab work. What it does provide is a welcome to Medicare visit during your first year, followed by yearly wellness visits. These wellness visits are important, but they're not full physicals. They focus on preventive care, reviewing your medical history, checking vitals, updating medications, and talking about risk factors. If you want a full physical with lab work, you could be billed unless there's a medical reason for those tests. This catches many people off guard because they assume annual physical under Medicare means what they grew up with, but it doesn't. If you want the no-cost preventive benefit, be specific and ask for your annual wellness visit. Now, before we wrap up, here are a few key 2026 updates that could save you money. First, Medicare Part D will raise its out-of-pocket cap to $2,100, up from $2,000 in 2025. The good news is you'll still be able to spread those costs out with a monthly payment plan instead of paying all at once. Second, every ACIP-recommended adult vaccine remains free under Part D, including shingles, pneumonia, and flu shots. Third, insulin stays capped at $35 per month, a big relief for anyone managing diabetes. And finally, dental coverage will expand slightly, but only for very specific medical cases like organ transplants or heart valve surgery. Routine cleanings, dentures, and implants are still excluded. And yes, over-the-counter hearing aids remain widely available, but Medicare won't cover them. So, what do you think? Of these uncovered gaps, vision, hearing, dental, long-term care, or physicals, which one worries you the most for 2026? Let me know in the comments, because I read everyone, and your experiences help others watching this too. If you found this breakdown helpful, give this video a like so more people can see it, and don't forget to subscribe for future updates on Medicare, Social Security, and the financial issues that matter most to you.